so we want to palpate the bones that make up the joint. So for talocrural, we're going to palpate the talus here and the lower leg bones, the tibia and the fibula. The talus is here. We feel it more in plantar flexion with a relaxed foot. When the foot is dorsiflexed, you get a little bit more kicked out. So we can palpate down the tibia to the medial malleolus. From there you would come this way. And you would continue to the lateral malleolus here. So you could come down the fibula to the lateral malleolus, and again the joint line kind of scoops around. So remember, it comes a little bit superiorly across, and then it dips inferiorly again, and then that medial malleolus. So the joint continues posteriorly, but we have all this Achilles tendon in the way. The dynamic palpation here is passive dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion. And here's where you'll feel most of the joint line. So you'll leave your finger there, you'll passively dorsiflex and plantar flex. So talocrural. For subtalar joint, so this is the articulation between the talus and the calcaneus. Subtalar meaning under the talus. So we're going to find the fibular or peroneal trochlea on the lateral side of the calcaneus. So you can come to the calcaneal tuberosity and move anteriorly and find that little ridge. So from there you're just moving a little bit anterior and superior. There's a tiny bit of a dip there, and the passive movement here is, or the dynamic palpation is inversion, eversion. So you're doing this for the body, inversion, eversion. So you can follow the joint line kind of posteriorly. That's about as much as you can feel. So for that subtalar joint, this is what we're palpating, that blue line. So you're coming to that fibular notch, fibular trochlea or peroneal trochlea, and then you're just kind of coming just a little anterior and superior, and you just feel a little bit of that joint line. See how you can't see that quite medially? This is a medial view of the foot because of the way the calcaneus is shaped. So we're just feeling that on the lateral side. So neither the talocrural nor the subtalar joint are on the OP. For talocalcaneonavicular joint, so again we're palpating those three bones that make up the joint. This is also your medial transverse tarsal joint. So the landmarks we can find are your sustentaculum tali on the medial side. So calcaneal tuberosity, move anteriorly to find that ridge on the calcaneus. Then you can move to the navicular bone. So if you're coming along the first metatarsal, first you're going to hit that first cuneiform or most medial cuneiform. Keep going, and it's that really obvious, the most obvious landmark I think on the medial side of the foot typically. That's your navicular tuberosity. So we have navicular tuberosity here, and we have sustentaculum tali there. So I'm just going to come a little bit between them for talocalcaneal navicular joint, and I can follow this navicular bone medially. So now I'm feeling where it articulates more with the talus. I'm basically following along here. So this is our medial view, and here's the sustentaculum tali, and then there's that navicular tuberosity. So we're coming between those two landmarks. And then you can kind of follow the edge of the navicular towards the dorsum of the foot, or kind of midline of the foot. So in an OP, I would palpate those landmarks. I would start at sustentaculum tali. I would find the navicular tuberosity. I would go between them. I would follow like laterally on the foot or towards the middle of the foot. And then you can see when we're looking at the lateral view, this is what we're feeling as we kind of come from that medial side. So we're traveling laterally, and then we're only going to come about that far. And you can see now where the joint is articulating is deep in there. So